My name is David Kleiman. I am a research fellow in the Department of Surgery at New York Presbyterian Hospital, Weill Cornell Medical Center in New York City. This week I'm presenting a study at the Digestive Disease Week in Orlando, Florida, highlighting the cost effectiveness of two different strategies for the early diagnosis of patients with gastroesophageal reflux disease, or GERD. GERD is extremely common. Up to 25% of patients experience GERD symptoms on a daily basis, and it's the most common indication of all GI-related illnesses for healthcare encounters. Proton pump inhibitors, or PPIs, represent an enormous cost burden on our healthcare society, as over $10 billion are spent on PPIs within the United States each year, and this number continues to rise. We suspected that a large portion of patients that take proton pump inhibitors in fact have no actual indication for taking them, and they have no objective evidence that they actually have GERD. Therefore, we compared the costs of two different strategies for managing these patients. In the first strategy, patients begin taking PPIs empirically and continue to take them for as long as they believe that it is necessary. In the second strategy, we encourage all patients to undergo 24-hour esophageal pH monitoring, which is considered the gold standard for objectively diagnosing or ruling out reflux. pH monitoring involves placing a small probe through the nose into the distal or the lower esophagus, and it directly measures acid levels and can confirm or rule out the diagnosis. We hypothesized that the cost savings that can result from avoiding lengthy periods of unnecessary PPIs in patients who do not have GERD would be greater than the additional costs incurred by performing this test. And therefore, we compared these costs. What we found was that in a representative cohort of 100 patients that were evaluated at our center, we found that up to 32% of all PPI usage beyond an initial 8-week trial was unnecessary, as they were taken among patients who had no evidence of reflux disease. Furthermore, the additional costs incurred by performing pH monitoring are far less than the potential cost savings that would result from avoiding these lengthy periods of PPIs. In fact, up to $6,600 per patient could be saved over a 10-year period if the patients had been referred for pH monitoring early. We feel that these findings, which we'll be presenting in detail at this week's Digestive Disease Week conference, highlight a very important finding in our healthcare system, and that is that proton pump inhibitors continue to be misused and overused in a large percentage of our population. And by referring patients for this pH monitoring, we could not only avoid substantial amounts of cost and provide more efficient health care for our patients, but we can also prompt patients to undergo further evaluation for the actual cause of their symptoms, which could identify potentially serious alternative diagnoses, such as heart disease or cancer, earlier in the course of their treatment. So not only might this save patients money, but it could also improve outcomes. Thank you very much, and I look forward to presenting the rest of our findings this week.